Okay, perfect. Well, welcome everyone to this Q&A with Crisis Text Line. I'm Jackie Escobar, Program Officer overseeing this grant with Crisis Text Line, and Kendall, my colleague. Can you introduce yourself?
Oh yeah, hi, I'm Kendall, everyone. I'm the Communications Director at Caring for Denver.
Awesome. So we're working in partnership with this. There's such a heavy marketing piece to the Crisis Text Line. And yeah, let me introduce our main person from Crisis Text Line. Jana French is passionate about increasing access to and reducing the stigma around mental health care. For the last 4 years, she's helped communities connect with Crisis Text Line, a national nonprofit providing free 24/7 mental health and crisis support. As a community partnerships director, she oversees the organization's keyword partnerships, which help other organizations understand how their community is using Crisis Text Line. She also works on state and federal grants. And previously, she worked at Phoenix House, a national nonprofit addiction treatment organization focused on referral partnerships in the New York region. Jana holds a bachelor's in journalism and a bachelor's in family and consumer sciences from University of Georgia, and she is currently pursuing her master's of business administration from the City University of New York. So welcome, Jana, and I will kick it over to you so you can let us know more about the Crisis Text Line.
Yes, and thank you all so much for having me. I actually need to update that. I've been here for almost it's 5 years next month. So getting time to write a new bio over here. So awesome. Well, thank you all so much for joining today. I'm really excited to tell you more about our work with Caring for Denver. Crisis Text Line is a free national nonprofit, but we've been really excited about working with Caring for Denver to bring more awareness to our resource in the Denver area. So, oops, it went too fast. Okay, so a bit about Crisis Text Line. We provide free 24/7 high-quality text-based mental health support and crisis intervention in both English and Spanish. We've been around for about 10 years. We launched in 2013, and we've trained over 70,000 volunteers to engage with texters in over 9 million conversations. In 2023 alone, we had more than 1.33 million conversations with folks across the US, and a number of those were in Spanish. Our Spanish service launched in 2021, and it's a fully acculturated service. So what we do is we connect people with bilingual crisis counselors so that they are receiving help not from a translation service, but from somebody who also speaks Spanish. About 2/3 of our texters are 25 and under. We know that from a post-conversation survey that we send out. And we are a member of the 988 network. So we take a percentage of national text and chat backup every day, as well as a percentage of Spanish text and chat every day. So the way that somebody can reach out for help is they can text the word Denver to 741-741. They can also use it in WhatsApp. We have 2 different numbers for English and Spanish, and WhatsApp just helps you get to the right person. And then we also have a web chat version on our website that folks can use the Denver keyword there as well. So here's what goes on when somebody texts in. So we first send a couple of automated messages back to folks. Usually I always says that they are connected to Crisis Text Line and has links to our terms of service and some resources that they can check out while they're waiting to be connected. And then it asks them what's their crisis. And people text us about a lot of different things. So people text us about, of course, suicide and depression and anxiety, and other mental illnesses, but they also text us about finals, or they text us about an argument they got into with their best friend, or they text us about feeling alone, or they text us about an issue they're having at work. So it really is kind of these everyday bad days that unfortunately we're all going to have at some point in time. Crisis Text Line is here for all of that. Even if you don't think it's a crisis to us. Like, we're happy to help you with what's going on. So we just want to help people get to like a calm, safe place. And that's really the goal of any conversation. So the texter gets the automated messages. We ask them what their crisis is. And then we have a machine learning algorithm that we built that helps us triage our texter queue. So it's learn the words that people use when they're at most imminent risk. And if somebody's using one of those words, we're going to put them right to the top of our line so they can reach those folks the fastest. And then from there, they're connected with one of our volunteers. So these are people who are located all across the country. They are logged in from home. They've gone through our 30 hours of training and a background check. And the training really covers things like active listening, empathy, collaborative problem solving, risk assessment, things that we know can really be applied to all the different kinds of conversations that we're going to have. Interestingly enough, we found this out last year that over half of our volunteers are ages 18 to 24. So while that's also the majority of our texters, we were surprised that that's also a lot of the people who are responding to folks are young people themselves. So the conversation is going to start by the volunteer really introducing themselves. They're going to do a risk assessment. We ask every single one of our texters if they're thinking about suicide, because we know that even if you are just having a bad day or you're stressed about finals, that might be going through your mind. And if it is, we want to help you through that. All of our crisis counselors are overseen in real time by a clinical supervisor. So they're seeing every conversation as it's happening. And usually they're just kind of cheering the crisis counselor on or giving them advice if they get stuck. But in the situations where somebody is potentially at imminent risk, then they will take a more active role in that conversation. But over 98% of our conversations are with folks not at imminent risk. They really are just looking for somebody else to talk to that day. And in situations where somebody is at imminent risk, we're able to de-escalate them about 60% of the time. So it ends up being less than 1% of our conversations where we need to work with local emergency services to help that person out. So for the majority of our conversations where we don't have to do that, we will then identify the goal, what this person really needs from working with us, do some collaborative problem solving to move them towards that goal, and then we'll wrap up the conversation usually after about 45 minutes or so. Sometimes during those conversations, and about a third of them, we're going to share a resource with the texter. So that's going to be a link from a database that we have of all free and national resources. And it's not always like a place to go. That is one of the things that we send to people, but sometimes it's a worksheet about depression. Sometimes it's a online support group. Sometimes it's like a breathing exercise to help them catch their breath. So we really can send folks a lot of different kinds of resources, not always a place to go, but of course we do send people places to go if that's what they're looking for. So at the end of the conversation, when it's over, we send out 2 surveys. So one is to the volunteer, where they check off any and all topics that were covered and list any resources that were shared. And we also check in with the volunteer to say, hey, how are you feeling? Because if we know that this is a tough volunteering opportunity to be taking these conversations, and we want to make sure that they're taking care of themselves. And if they need to step away after a particularly tough conversation, the supervisors who are on the platform want to support that person in doing that. And then our texters receive a link where they can tell us how they think we did, how they feel now that the conversation is over, and any demographic information that they're willing to share. And people fill that out about 20% of the time. So that is how we know that a majority of our texters are under 25. We know that over half of our texters identify as LGBTQ+, and that nearly half identify as BIPOC. So really, we're reaching a young, diverse set of folks with our service. So yeah, I think that's a lot about how our service works. So I'm going to talk a little bit about our partnership with Caring for Denver. So we are really working together to localize this national resource. So the keyword Denver, what that really lets our volunteers know is this is coming from our partnership. And if the texter is looking for a resource, usually if they're looking for a place to go, that we have some Denver resources. We're still working on implementing that, but it's one of the things I'm hoping to talk with you all after my presentation about. So if there's a place that they're looking to go, then that would be, we could share that with them because of this Denver keyword. We also got suicide prevention resources for every middle school and high school in Denver public schools sent out. So those are posters, help guides, pens, stress balls. And that's something else that I would love to talk with you all about. We're going to launch on April 1st a citywide marketing campaign to youth to help them understand that Crisis Text Line is here and all the different kinds of things that we can help out with. I was just telling Jackie and Kendall about some of the ideas that they had around helping people realize that they can text us about relationships. And that's, that's friendships, that's family, that's friends, that's romantic partners. and that they can text us when they feel alone, or if they are worried about, like, do other people feel the way that I'm feeling, that we can talk with them through that. And then we also are partnered with Metro, and we're working on partnering with Denver State University on expanding our practicum placement opportunities for people pursuing a master's in mental health. We have a couple of different kinds of degrees that we support there. But what that is, as you all might know, like if somebody is trying to get, for example, their master's of social work, in order to complete their degree, they have to do sometimes 500 to 900 unpaid internship hours, where they have to go into an office and have a caseload. And that's a huge barrier for people to be able to get those degrees, especially somebody who is, paying their own bills, has a family, doesn't want to stop their current career to get into this new one. And so we help them do their practicum hours with us. So at least it's online, it's at home, they can do it overnight when their kids are asleep, and they don't have to take time away from the 9 to 5 where they are otherwise occupied. And then the last thing is really part of what we're doing right here, right now, is talking to community organizations about how to use crisis text line, when to use crisis text line, and really how to share it with the folks that you work with so that they know that we're a resource and we're here for them. So on this next slide, I have a little bit of some of the materials that we have created. Got sent out to all of the Denver public schools, but I have some as well that I'd be happy to share with your organizations, especially these posters. And you can see that they are in English and in Spanish. Unfortunately, this How to Help Others with School Stress is only in English. And then we have these cards that are front and back English and Spanish. And then before we go into partnership, how we can partner together, I wanted to share just a bit about how to share crisis text line with your teammates, with people that you work with. The first thing that we tell people do is like just save 741 as a contact in your phone and leave a note to start the conversation with Denver. Honestly, you could text us any word. You could text us, you could leave your phone unlocked and accidentally text us like letters, numbers, gibberish, and we would still respond. That keyword Denver really just helps us understand, one, how you found out about us, and helps us really track our impact. So we can share back with Jackie and Kindle, hey, last month we had 50 people reach out. And that's how we know that what we're doing is effective. And then also as WhatsApp contacts. And then I have like sort of a sample message here about like how to really share this with somebody. I know that folks in different community organizations are probably like me, and they get messages from their friends, or they get messages from people they work with, or they get messages from family members when they're not doing well, because they know that you're a safe space, that you work at a nonprofit, and they're like, hey, I'm struggling. And sometimes I'm not in the place where I can support them, or what they're dealing with is more than something I'm able to handle. So what we always like to tell people when they're sharing our resource is to use some of the things that we train people on, which is identifying the strengths that this person took to reach out for help. So and being open and being vulnerable, and also helping them see a little bit of the strength within themselves. So not only being thankful, but also like, that's really brave. It's really brave that you reached out to me about this, and I care about you, and I want you to get the help that you need. And I think crisis text line could be a good resource for you to check out, especially if it's 3 a.m. or you're already in bed and your friend wants to get on the phone. Not tonight. That's what I like to tell people, that leave that on your out of office and things like that. And then we always also say you can text into us alongside someone who is nervous about reaching out, so that you can have a little sample conversation with us. We see over 3,500 conversations a day. So you texting us about, like, even if you are, just making up the situation, is not going to like burden our system. We're going to be fine. So if you want to text us next to somebody so they can kind of get a sense of what's going to happen, we always recommend that as well. And then also letting people know that we're here for everything. There's nothing too small or too big. We are here for it all. We really just say if it's a crisis to you, it's a crisis to us. So, you know, letting people know that this is for them. It's for everybody. We're unfortunately, I wish this wasn't true, but we're all going to have a bad day. So we're here for all of that. Okay. So the last slide I have here, oops, oh geez. Okay, is just some ideas for how we can work with you all. So one is that if you have any resources that you think Denver Texters could really benefit from, you can send it along to me and we will run it. I'll run it by our clinical team. What we typically have in our resource database is things that are free and national. And like I said, it could be worksheets, it could be a website, it could be an exercise, something like that. So it doesn't always have to be a place to go. But if you have something like that and you think that our Denver Texters could benefit from it and our clinical team agrees, then we'll add it to our database so that when somebody uses that Denver keyword, if they are looking for a resource, we would share that link with them. It wouldn't be sort of like a direct referral thing. It would be just a link. And like I said, that happens in about a third of our conversations where we share one. If you want some printed materials or social media assets about the Denver keyword, I have both and I'm very happy to share. And I'm also happy to give a presentation like this to the rest of your staff. So letting them know kind of what crisis text line is. You know, we can talk ahead of time about the community that you serve specifically within Denver. And so I can really personalize it to that as well. And anything else. We're open to collaborating with you all. We've just been so excited to join really this Caring for Denver, you know, family, and like want to work with you all to make this you know, a stellar partnership. So those are some ideas. And then here is my email where you can reach out. And I'm happy to answer some questions. I also have on here my colleague Courtney, so she can answer questions as well. So I'm going to stop sharing my screen so we can have a conversation. If you want to put things in chat or if you want to come off mute, I know we're a somewhat small group, so whatever folks feel comfortable with.
Can you put your back up there for me?
Yeah, here, let me do this for you. Let me put it in the chat. That way you can copy paste.
Jana, can you also talk about what is the criteria if an organization feels like they may be a good resource? I think I recall you saying like needs to be free, no wait list, some of those things. And again, those would be some of the considerations.
Yeah. Let me actually get for you all the link on our website so I can show it to you exactly. So here's a link and I'll share my screen again so you can see it. Okay, so these are the criteria that our clinical team looks for. So free, low cost, or sliding scale, being another nonprofit, check. And that don't discriminate or use harmful language. Something that is really beneficial and factual. Excuse me. And then that's compatible. So this is you know, a somewhat exhaustive list here, but just so that you have it, this is what it is. So, and you can also see here some of the other examples that we have. So one of that I really like are in this section. So I think this is a really fantastic workbook that we share with people, but it's also things like the Anxiety and Depression Association or resources to help elderly people connect, Depression and Bipolar Alliance. So it really varies. We have over 800 in our database right now. Okay, would it be possible to get a copy of the survey that is sent to volunteers and the person texting into the line? Yes. So I'm going to share the link with you all. Just don't fill it out. Let me find it.
And this is for the Hi, everybody. I'm Courtney Hunter, she, her pronouns, Vice President of Public Policy at Crisis Text Line. I work really closely with Jana. And this is the post-conversation survey that is sent to texters. It's completely optional. Jana mentioned, I think about 20% of our texters fill it out. And that's where we really get our demographic information. But to the question, just want Lauren to be clear and just to clarify that we are totally anonymous service. So we don't have information about like names or anything like that, and we don't keep that information. We would have no need to. And yeah, we want people to be able to trust us as a service. So we're totally anonymous and confidential, which is one of the reasons we think we over index for, you know, specialized and marginalized populations.
And we're also are always only by text, so we are never on a phone call. But yeah, and this, like Courtney said, this is an optional survey. About 20% of folks fill it out. And then what we are able to do with that is because they use a Denver keyword, like I said, we can share back with Jackie some high-level anonymized and aggregated insights into how people in Denver are using Crisis Text Line, the kinds of issues they're reaching out about in general, demographics that we get from this survey, how satisfied people are with the conversations that they have. And it's never like, oh, Jana texted in at 2 p.m. on Tuesday about depression. It's, you know, 50 people last month were texting about these variety of topics. So it's very aggregated in that way, but that's what helps us. That's what we use this. That's what we do with this information from the survey.
Jana, another question I've heard from others that I think you could answer, lovely, is if some, like, how do you approach texters who text multiple times? Like,
Yep. So there's two different ways. So we know that like roughly, if we look at how many conversations we have versus how many texters we have, so that would be conversations, whereas texters would be like a unique phone number of somebody reaching out. People do reach out to us on average like twice over the last 10 years. And so at that level, or, you know, even if you reached out to us today and then you text again next week, every conversation would be brand new. So we wouldn't say like, oh, Jackie, I see you're back. How's that exam going? Like, it would just be brand new. We do keep notes on like what resources we've shared in the past, and then coping mechanisms that people said that they liked in case somebody comes to us and we want to make sure we don't send them the exact same resource. And we want to make sure that if they get stuck on like how to feel better, we have that, but that's the only thing that we kind of carry over conversation to conversation. And then if somebody is texting us multiple times in a day, like very many multiple times, there's a little bit of a unique workflow that we do for that, where it's kind of sent directly to a supervisor. And because at that point in time, we're not the best help for them. So, but that doesn't happen super often. Does that help, Jackie? Cool. Yes, and so like Courtney is answering in the chat, the first line of people responding are all volunteers. They've gone through our 30 hours of training, and they are most often young people themselves, but it really could be anybody from anywhere across the country who has, you know, stable Wi-Fi and a computer. And they're being overseen in real time by supervisors. So if you think about like a traditional call center, usually there's like one or two supervisors who are kind of walking around saying, hey, how's it going? That is not how it goes for our service. We are all logged into one platform. I like to say that it kind of looks like old school AIM, where you've got all of your friends on the side who are also volunteering with you. And then at the bottom, you have your supervisor who's overseeing all the conversations as one chat box. And the other chat boxes are the texters that you're helping. And the supervisor's screen has all of the conversations they're overseeing on it. So they can look at everything that's going on at once. And, you know, if it's a conversation with a volunteer who's been with us for a long time, and the conversation is, you know, about school stress, then the supervisor knows that they don't need to check in on that much. They might, you know, send the person a few messages, send the volunteer a few messages saying, hey, you're doing a great job, or, oh, I love how you message this, or let's try wording a different way. Whereas if somebody is having a conversation where they're dealing with active suicidal ideation, that conversation is going to be at the top with like the most supervision on it, to make sure that we are doing everything we can to help that texter. So that's how that really works. And what's really nice about that model is it helps us kind of expand the clinical oversight of this one person. So we're able to help so many people because we have volunteers doing the answering, but they are being overseen by the supervisor and really instructed by them. And our training is online. It's 30 hours. It's self-paced at the person's own choosing of when they want to take the modules. We say it's 30 hours, but really it could take somebody more, it could take somebody less. I think that I don't think I took 30 hours to do it, but that's the average. And it covers things like active listening, good contact techniques, strength IDs, empathy, practicing like cultural humility. That's funny, Courtney. And how to recognize bias and overcome that when you're having these conversations. And risk assessing is another big thing that comes up in the training. So it's all videos and reading and tests. And then the Spanish training is somebody would complete the English training and then they would take a 7-hour Spanish module that really covers things like how to recognize somebody's gender in a gendered language, how to, all of the different dialects. And if you're talking with somebody who uses a different dialect of Spanish than you, like how to really kind of meet in the middle somewhere. And then topics that are going to come up more often for our Latinx texters, like immigration or multi-generational family households. So, and that is all in Spanish. So I've been learning Spanish and do my Duolingo best when I was reading through that training, but certainly did not get all of it. And yes, like Cordy said, we do have practice simulation conversations that are sort of like our final exams for some of these chapters. And then we also have a simulator that volunteers can use at any point in time to kind of like refresh their skills or practice with a specific topic that they haven't encountered through a texter before. So yeah, that's everything that goes into the training.
Thank you, Jaina, for sharing this tool. I cannot wait to share it with our interns. That's another of our offers and missions. Is like we offer internships as well. So we have counselors, future social workers in 18 schools, and
Oh,
we
wow.
see youth from 8 years old to 18 years old. And I find that, like, as I said, I cannot wait to share it with them. And then I have like 2 questions. Would you be able to do like a presentation for all of our interns online? That would be one. And the second one, do you think I can have access to these slides? Because that's what I said, like, it's not only for the clients that we're seeing, for the students that we're seeing at the schools, even for the urban siblings, and even for the families, to break that barriers to access mental health care. That's one of our missions as well, yeah, and engaging the Latinx community and others. So those 2 questions, would you be able to do that online, and can I have access to those slides?
Yes, and yes. I also want to make sure that, so we have been working a lot on like reaching Denver youth, but anybody can use our line. We've had people younger than 13 and older than 65. So, there's no limitation there. And then I'd be happy to. I actually live in New York, so does Courtney. So most of my presentations will be online, but I am planning to make a trip out to you all at some point in this year. So whenever that happens, I'll be happy to do something in person. But for now, we are Zoom. And then I can share these slides with you. They're not quite meant for like public dissemination, just because it's like sort of I don't know, it works best when I'm talking through it, but I'd be happy to share it with you.
And Jaina, can we get some like printed materials in Spanish for Encore too?
Yeah, I'd be happy to send those to you.
Okay. Would that be helpful in terms of your, yeah? Okay, cool. Your needs, because we've got in English and in Spanish. So that would be awesome. And if you'd like, for the presentation about Crisis Text Line to be in Spanish, we can ask one of our Spanish clinical supervisors to deliver that. You would not want Jana or I to do it.
But we do have folks who are fully fluent
Yeah.
bilingual.
Yeah.
I just am good enough
Native
to make my way
speakers.
around Spanish-speaking countries.
Mostly
Yeah,
foods. I know mostly foods.
Ankur, if you send me your email, I'll coordinate with you on getting some materials to you, so you can share them out. And then if they are social workers in any of the Denver public schools, they should have we sent a bunch of posters and stress balls and pens to all of the middle schools and high schools in Denver. So hopefully they would have them there as well. Awesome.
And
Great.
there's a
I'm
question.
I'm meeting Jackie for that. Yeah, if I'm not wrong, Jackie, I'm meeting you next week.
That's
So
correct.
so that's awesome.
Yeah.
Thank you very much.
Yes, that's absolutely correct. And then Claudia had a question about how is the texting with older individuals compared to the younger population? And I do want to reiterate, even though this is geared towards our younger people, it is open to anyone. So yeah, back to you, Gina.
Yeah, it's the same. So like Courtney mentioned, we don't really, the only question that we ask people about themselves before we like have a conversation is what's your name? And that really just helps us kind of build rapport with the texter. They could tell us they don't want to tell us their name. They could tell us that their name is something that's not their name. It doesn't matter. It's just what we want to call them by. But we don't ask their age. We only know their age, and we wouldn't know it directly to that conversation through that post-conversation survey. So it's the exact same service no matter what. And it's statistically, we have less older texters than we do younger texters. So about 70% of our texters are 24 and younger, but the other 30% are 24 and older. So we do serve them.
We can look, Claudia, in terms of like the issues that are mentioned and how that differs among young versus older individuals. I can tell you offhand, school is mentioned a lot more, and like friendships and things like that are mentioned more among young people, and then, work stressors being something that's mentioned, among older people, right? Like just as a differentiator. But a commonality in a lot of our conversations is depression, anxiety, and stress. And also relationships continues to be a big topic of conversation among all, like any like familial relationships, romantic relationships, like big stressor for people. And then, how are emergencies reported, Christy? So, Jada, do you want me to take this one?
Yeah, go for it. I'm downloading the presentation. I'll put it in the chat.
Cool. Awesome. So, around like 1 to 2% of all of our conversations level up to an emergency services intervention. And then our supervisors would come in if they're unable to safety plan with the texter. And they would utilize our database and that texter's information to contact a local PSAP, public safety access point. And then over the phone, connecting with that PSAP, they share all of the information, relevant information, lethal means, what's going on with the texter, relevant information that they have to the crisis. And then depending on the local resources that are available, whether it's mobile crisis, whether it's EMS or police in some instances, then those are dispatched based on the situation. And then, yeah, Jana, what did I miss on that?
The only other thing I would add is that we are also mandated reporters. So if there's like suspected dependent abuse, that would be something else that we report. We do need a bit of information from the texter to be able to make that report. So it's not something that we just can do. So that's something else that we work on, that we see as well.
Just recently, we saved a child who was kidnapped, and who texted us. And we don't have all of the details to share, but that was just, it's very rare. But when those situations do happen, for some reason, this teenager had crisis text line in their phone. They were kidnapped by a trucker. I mean, we hear these, Jane and I hear these stories. So that you just made me think of that when you were talking about mandatory reporting. Because it's rare, but it does happen. And so we always tell people, like, put crisis text line in your phone. You might not be able to call or text 911. But maybe if you're texting, kidnapper or whatever the situation is, maybe it's more discreet and you're able to do that, get help.
Yeah. Have we noticed any barriers to support communication with individuals who identify as neurodivergent? I have not heard of that really coming up. One of the reasons that I suspect it might not be is because people can connect with us on text, WhatsApp, or on web chat. So it's on sort of like their own device with their own settings, and there's no like app or anything. So I think that's that's probably one of the reasons why that doesn't come up in our conversations. We do ask about people's different disabilities I don't think that's the right word for this, but we ask for people's different diagnoses that they want to share in that post-conversation survey. And I do know that a number of people do check off like ADHD or autism. So we do serve people who are neurodivergent. But I don't know. I think the big thing would be understanding how to reach folks and let them know that we can be a resource. And if you have any ideas or if you come across any barriers, please do let us know, because I would love to work through them with our teams, whether that's, because a messaging was not working or because the tech wasn't working for some reason. Courtney and I can really elevate that to the right people internally and help remove any barriers that we're able to remove if you come across any. Thanks, Destiny.
Awesome. Well, you can still put in questions in the chat. But also you can reach out to me. Jana is very accessible. We're hoping that this is a resource that really the Denver community can benefit from. And as Jana indicated, it's available to all of Colorado. So definitely don't want to limit it at that, but this is the focus. That Denver keyword really helps us identify those needs and issues that are facing the Denver community. And so that's why it's important for us to be supporting this effort. But I think if there aren't any other questions, I'll let you go ahead and close it out, Jana or Courtney, and then
Yeah.
reach out to me or Jana regarding resources.
Yeah, just thank you all so much again. I put my email in there. The slides are in there. The slides have my email. We're just really excited to collaborate with you all. So any ideas that you have or any resources that you need, please reach out to Courtney and I. We're really excited to work with you and to get this resource into the more hands of Denverites. So thank you all so much.